true believers, let's talk about knees here, especially ACL surgery. Now, I have personal knowledge about ACL surgery because I had ACL surgery done on my right knee in my mid 20s when I was in graduate school. So, fast forward like 20 plus years later, and it's it's doing very well. I haven't had any problems with it. And let me explain to you the decisions I made, or we made with my doctor in terms of what procedure to get when we were gonna when we were trying to pick our ACL surgery. So the first question you're asking is allograft versus autograft, and let me give you some background here. So I injured my knee when I was in college. I was playing on asphalt, and it rained and there was some loose gravel on the asphalt. I planted my right foot to drive and do a layup, and the ground gave out on me. My shoes didn't have the proper traction. This is why I don't like to play on asphalt anymore after that. And my knee gave out and tore both my meniscus and my ACL, and it was like so painful when it happened. It was just like a blinding white light. I couldn't walk, I couldn't sleep. So it was pretty bad. And then I mean, I didn't have insurance at the time, so I just kind of lived with it, and I couldn't play any sports. I mean, I could, just as long as I didn't jump or pivot or suddenly stop. I remember I was playing softball with some friends, and there was like a fly ball. I started running and I got caught, and I had to stop and run back, and my knee gave out on me. So it's just I avoid things like that. So I can play sports just as long as I'm mindful that I can't suddenly stop. When I play basketball, when I didn't have an ACL, I would just pick the guy that didn't shoot that well outside. I go, hey, I can't guard anybody that shoots outside because they can dribble past me very easily. But if they don't shoot that well, then I can play them loosely, kind of zone them, so that way they don't have a clear layup. So that's how I kind of played basketball, and I didn't jump. If I was going to get a rebound, the most likely I would do is box somebody out and let the ball land somewhere else, and so they wouldn't catch the rebound. But anyway, fast forward 5 years later, a doctor, when I was in graduate school, I had student insurance. I had student health insurance, and I said, "Hey, I'm paying a lot of money for this student health insurance. I think like $1,000 a year that's taken out of my tuition." And I said, "You know what? Let me see if a doctor will take this insurance." And lo and behold, I approached a doctor who worked very closely with our school, and he said, "I'll take that insurance, and whatever bill that comes in, I know you're just a student. I was a student also. Just if you can pay it, pay it. If you can't, then you can't." And of course, I said, "Okay," I can't. So yeah, and the reason why one of the reasons why he wanted me to continue with the surgery is because he was part of a study. He was doing a research study on the continuous passive motion machine, and he was part of a group that's doing research on it and trying to get it approved for insurance purposes, that it was effective. A continuous passive motion machine I was included in that study. So part of it was like I was like a guinea pig, but like a good thing for the continuous passive motion machine. So I continuous passive motion machine is like, once I got done with the surgery, like 6 hours a day, this thing would like just rotate not rotate, but continuously extend and flex my knee and continue moving as soon as I got out of surgery. And they're trying to prove is it helps with recovery. So that's kind of the reason why I was able to get in there. He was looking for patients for his research study that he was involved in terms of getting the continuous passive motion machine approved for ACL surgery recovery. So hallelujah, thank goodness I was finally getting my surgery done, because it was like bothering me for the longest time, and I just couldn't. I was just like a shell of myself without my ACL. So So now the question is, which one do we get? Allograft versus autograft. Okay, allograft versus autograft. It's not autograph where like you get somebody's signature. Okay, autograft, graft. The difference between allograft and autograft is an allograft you get it externally, like from a cadaver, from a donor, and even some animals like cows or something like that. But I think they stopped doing that. But and I had this back done when I was back in California. Uh, what they usually get it is from cadavers. People who had a motorcycle accident, and then they would harvest their body parts, hearts, cornea, including their patellar tendon. So what they would do is they harvest their patellar tendon and tibia and kneecap, and then they would treat it and sterilize it and make sure that you can transfer it to another body without getting any infections. And then so that was the choice, allograft. Okay, and now the other one is autograft. Autograft means self, which means you get your own patella tendon, or the other two sites where people get it from is the quadriceps tendon. Well, they'll take a big chunk of your quadriceps here and take part of your kneecap. So you've got like a bone, soft tissue, and then the other one is the semitendinosus and gracilis hamstrings. So those are the other two options. Now, before I got the surgery, I had a classmate, and she was skiing, and she got hit by a snowboarder while she was skiing, and the snowboarder took off, and they couldn't figure out who it was because there were a bunch of snowboarders. So from then on, she hated snowboarders. But that's always been ongoing, skiers versus snowboarders. So she injured her ACL. It was completely torn. So her doctor did a autograft, not allograft, and used her patella tendon because that was supposed to be the gold standard. And the problem is, because it's with a girl, you're not gonna have a very big, huge knee like this with a big bone stock and a big tibia and a big old tendon here for you to work with, and then stick it up into your knee joint and ACL. I think that was the biggest. I mean, that would be my guess, is the doctor had to take a big enough piece for it to be an adequate ACL. And when she told me about the surgery, she said her anterior kneecap pain was like more painful. I mean, the knee surgery itself was painful, the drilling and everything, but she said that was more painful than the actual surgery. To add insult to injury, while she was recovering, I think she slipped and fell and kind of retore it while it was, but when I talked to her about it again, she said she wasn't gonna go through the procedure again. As the last I spoke to her, and just kind of live without an ACL. I mean, you can live without an ACL. She wasn't, other than skiing. You could ski just as long as you don't do any jumps or anything that extreme. You can't do any hot dog skiing. So she decided at the time I was talking to her that she wasn't going to have it revised. So after that, I was just kind of going through my head, like going, why would I want to risk that? I think part of it is I don't think girls are a good idea for autografts because they just have smaller body parts. I don't mean to be sexist or misogynist, but it's just the simple reality. So I think that was a mistake for her to go with that. So that kind of affected me. So when I talked to my doctor, I was already coming in biased, and I said, I'm going allograft for the win. I don't care. And these are the risks. Here's the allograft. The risks are that you're gonna have you might have a rejection because it's not from your own body part. But I told, and it's a small chance that it happens. And I told my doctor that, like, hey, it's not vascular. It's not like a heart transplant. It's not like a kidney transplant. It's not like a bone marrow transplant. I mean, the bone it has bone, but it's just the bone matrix. It's not going to have like the actual living cells in it. I think it must have been like the way it's sterilized and refrigerated. It's basically a dead bone and just like a dead tissue that they're just keeping preserved to put in there. So when your body has a bridge to remodel it. And that's probably its biggest disadvantage, because you're starting out with a dead tissue versus a live tissue. But we'll get back to that in a minute here. So I said I'm gonna go allograft all the way for the win. And another factor that determines it was I wasn't that active. I was like a full-time student. I wasn't doing any sports. If I was just doing it recreationally with a bunch of my other weekend Sunday leaguers, the other weekend warriors. So it wasn't a high level every once in a while just to kind of blow off steam activity. So we're not that competitive. It wasn't a high competitive D1 type of competition. So I said allograft, and the other risk is that you might get some kind of communicable disease, which is, it's like a 1 in a 1 million chance. So I said, you know what, if I have that kind of bad luck, I'll take my chances, because my doctor says, yeah, you have a good point. I would probably do the same thing also, because he's in the same situation. He's like not competitive, and the big advantage is that it's just the recovery was so fast. I don't even remember like using crutches. I remember like for one weekend I was just like, the hardest thing about the surgery was like not being able to pee, because I was like under general anesthesia, whatever it was because it's either a spinal block or general anesthesia. I couldn't pee until the next morning, where I could finally have control over my relieving functions again. But it wasn't that bad, because you couldn't eat any or drink anything anyway before the surgery, so it was no problem holding it. So and that's the only thing I remember. Then just I had the ice machine. So he gave me the ice machine. He gave me everything because he wanted me to have the best results. So he prescribed an ice machine. So it was continuously, the swelling was just like minimal. And I think I was back to school the next week. I don't remember. I just was just hobbling along. I don't even remember using crutches. That's how, because it was so minimally invasive. They didn't have to tear into my knee. They didn't have to take my hamstring graft. So I loved it. The only down part was that it was going to be remodeled, and it was going to take, usually the studies have saying that it might take over 2 years, because you're starting with the dead tissue from a donor cadaver, that it's going to take up to 2 years to remodel so you can get back into competitive sports, which is perfectly fine with me, because the advantage was that like my hamstrings are healthy, my quadriceps is healthy up to this point. And oh, by the way, when he did the surgery, he also fixed my meniscus. He stitched them together. He said, oh yeah, they were like torn apart, so he just stitched them back, and everything's fine. So from then on, I can play basketball. I haven't been playing basketball that much, but anyway, I used to, and I've had no problems with it. Do I jump a lot? No, but when I do, when I'm caught up in the moment, I've had no problems with it. So I love the allograft. And that was my first choice for Hero when we were looking at ACL surgery. It's like allograft, but everybody's gonna say that don't get the allograft because he's not the right age for it, because he's still young, he's gonna be very active, and he's gonna most likely tear it. My response is, I went through the same thing, and I said, so what? I'll get another one. At least you can never run out of cadaver grafts, is what I was saying. So that was when we were going to talk to the surgeons. That's what I was going with. Okay, well, it's like the research says it's 5 times more likely to tear. It'll take longer for it to rehabilitate. They say it'll take an additional 4 months or 6 months to a year, and he's gonna get back into sports and that long. But at least the best part about it is if we do tear it, it was somebody else's, bless their soul. but we can redo it again. We can do another revision. Of course, revisions themselves is another discussion. If depending on what screw you use, I use titanium, and if I needed to do a revision, I don't know if they have to go through another tunnel or if they have to remove that titanium. And that's 2 procedures. Wait 6 months for it to fill it back in, and that's another a complication in itself. Also, you got to wait for it to fill in, then do the. So that's 2 separate procedures. So there's a lot of risks, not just that like, oh, hey, get me another allograft. Okay, it's more complicated than that. And that's kind of what I was going back and forth with when it comes to Hero. But I was still biased towards the allograft versus the autograft until we started communicating and consulting with different doctors. When we consulted 4 different surgeons before, and I did my research and talked to people, and these are the people that are recommended, and looked online to confirm that their testimonials, and went to go visit them, and only to find out that allograft or donor graft or cadaver graft is not an option here in the Philippines, because there's absolutely no market for it over here. Just like there's certain specialties that are not available over here. It's just people are just not going to spend that kind of money on that kind of elective type of procedure. So we went to the first one. They said, no, never done it here because none of the tissue banks have it available over here. And they pretty much all said the same thing. And if you want to get an allograft, you would have to leave the country and go somewhere, probably like Australia or Guam or Singapore or Thailand, maybe Thailand. But anyway, not Guam. I mean, we wouldn't have to go all the way back to America for it, but I'm sure they have tissue banks that, I mean, they could probably have it sent over here. But probably the other biggest problem is like the procedure costs probably like $3,000 to $6,000, while the graft might cost like that much, like $7,000 to $8,000. So it basically comes down to economics, why the people over here have never done that, because it's such a rare medical item that it's going to cost several thousands of dollars. You're talking about, I was thinking maybe like a $4,000 or $5,000 minimum to get an allograft, and even then you're kind of concerned about where did they get this allograft from. Did they get it from like an 80-year-old person or from like a younger person? So those were the kind of risks that I was going through in my head. And then so I was talking to the doctor that we decided with, or that we're most likely going with, just said that like for him, it's just the best thing to do is just to go with an autograft, because it's going to be stronger, it's going to heal better, it's going to heal faster, he's going to get back into sports, and the technique and the technology and that they have now. So what is our decision? So we're gonna go with this doctor. And you can tell when it comes to doctors. I've talked to a lot of doctors, and I have some experience in it myself. That once doctors start doing something like a long time, many times, that they can even do it in the dark in their sleep, to them it's less of a technical thing and more of an art form. It's more of a feel. And that's what I wanted to feel when I was talking to the doctor. I mean, if he said that, oh, I've done over 10,000 of these procedures, and that was like before lunchtime, that's just how long and how the doctor that we're going with practically invented the procedure. And over time you do those many things. I mean, doctors develop their own techniques, what works, what doesn't work, and not the same technique works for everybody, and you have to do this procedure so many times over so many different patients to finally get it exactly right. And it's not a science, it's always an evolution. You're always fine-tuning and you're always customizing every procedure, because every patient is different. So that's what I wanted to feel when I was talking to the surgeon that we were going with. Now, not one that was like the first one is. I know the first one, not the first one. Probably the second one was like a bad example. It's like he said that like the best thing to do is just change sports because it's not going to be the same thing, right? It's not, but it's like not playing sports or not playing soccer for Hero wasn't an option. So this is what we're going with. So in terms of allograft versus autograft, here in the Philippines, it's not a matter of choice. You're going with an autograft. Now you have to figure out the best thing to do is do you feel comfortable? Do you feel the confidence and the technique of the doctor to give you the best results? And that's what you have to. That's why we consulted several doctors just to make sure that we were comfortable and that we were confident that we were going with the right surgeon for the right procedure. So, he said, and we weren't going with the patella tendon. We were going with the hamstring. So he said he has his own technique where he says that he has, and my concern is like, will it regenerate? Will it grow back? And he says, yes, I have a technique also for that. And I said, okay, good. I mean, there's like a 20 something % chance that the hamstrings don't go back to normal, and at least I'm confident enough with the doctor and with Hero's rehab and with his therapy and the people that he's going to be working with, that he's going to be in the 80% that's going to get his hamstring strength back without and then he doesn't have to deal with the rejection or the strength or the remodeling of having to worry about how long it's going to take for the tendon to remodel to become the ligament. Anyway, that is, so if you made it this far, at least you know exactly how we went about in terms of making your decision, which type of graft and which surgeon that we went with. And if you have any questions, I will be doing a lot of vlogging, especially as the procedure comes along and as on his road to recovery and to rehab and redemption continues. All right, that's it. If you have any other additional questions, I pretty much said what procedure we're going with, which graft, and which doctor that we're going with. And the quadriceps tendon and the patella bone tendon, like I said, there's just too many complications with it. I mean, the quadriceps tendon is perfect, I think, for revisions, but for your first choice is go with the hamstring tendon. Okay, if you want me to discuss or you have any additional questions, let me know in the comments. I'll see you in the next vlog. This is Belts Only, so that's the update with Hero's ACL road to recovery. Thanks for watching. This is Belts Only.